Hi, my name is Irving Rapheal, Dr. Rapheal. I'm an orthopedist on staff at St. Joseph's Hospital. I am the head team physician for Syracuse University. I'm a partner in Rapheal Sports Medicine, which is a division of RSM Medical Associates. Many of you may see me. I do a lot of treatment and surgery at the Northeast Surgery Center. I want to talk to you today about platelet-rich plasma, what we call PRP. PRP is one of the more recent treatments that we have available for treating athletic injuries, both acute, brand new injuries, and chronic, long-term injuries. It has now carried over to our practice for the general public for injuries in addition. The major use we found for PRP is for what we call soft tissue problems, problems with tendons, muscles, ligaments around the shoulder, the elbow, the knee, the ankle. Many of you may have heard about it in the news recently. This past year, in the sports page, Kobe Bryant and Alex Rodriguez both made headlines having had PRP injections. They did not come to Syracuse, unfortunately, for their treatment. They went to Europe. But we do the exact same treatment both in our office and in surgery at Northeast Surgery Center. It's referred to as a biologic treatment. The treatment involves the patient's own blood. The portion of the blood that we refer to as platelets carry special proteins called healing or growth factors. When there's an injury in the body, the platelets release these growth factors that help heal certain areas that are injured. The purpose of the treatment is to take these platelets and concentrate them, a higher concentration, higher volume of platelets in a small volume then, to inject into the area that's injured. So in the office or in surgery, what we do is draw a sample. I'll give you an example here. We draw a sample of the patient's blood and place it in a special tube. The tube then is put in a spinning machine called a centrifuge, and it separates the platelets, the red cells, and the plasma, the serum. This is an example of the tube. The blood is placed here, spun, and the platelets can then be separated out from the rest of the blood. Once that's done, this small amount of platelets can then be injected, whether it's a rotator cuff, tennis elbow, tendinitis in the knee, Achilles tendinitis. At Syracuse University, where we are the treating doctors, we see many athletes with acute injuries, a pulled hamstring muscle, a strain of a knee ligament, a severe sprain of the ankle. These are where we use it frequently for what we call acute injuries, and we found that the return to play, the time it takes to get back to activities, is much shortened by using this treatment. For the chronic problems of long-term tendinitis, patients who have been through medication, rest, therapy, various other types of treatment and not getting better, we found that this type of treatment using PRP has been able to heal tissues that have not healed otherwise. My suggestion, having learned about this, is if you have a question about this, feel free to call our office. PRP is not used generally throughout the area. We have a little more experience because of the amount of athletes we deal with. So if you have a question, feel free to call the office. Be happy to have you come in for an office visit and consultation about that. Our office number is 701-4024. 701-4024, and explain to our secretaries that you would like information about platelet-rich plasma or PRP. Thank you for listening.